So my name is Priya Kishnani, and I'm a clinical and biochemical geneticist at Duke University. And I feel I have grown with this community. I started my career here presenting the first results from the CHO cell enzyme and the first 3 babies who were treated with enzyme replacement therapy. And to think that years later, we are here today with a better understanding of the breadth of Pompe disease, not just from a diagnosis, but also in terms of the clinical spectrum, and then most importantly, what can we do better for our patients? And I think today's, as we start the session, it is absolutely going to be exciting to hear from 3 of my very dear friends and colleagues. And I'm going to invite them to the podium, and in the interest of time, we'll do a very brief introduction so that there is more time for Q&A at the end. And so I think it's going to be started by Dr. Henrique from the Netherlands, and she is a pediatric neurologist and is going to talk about classic infantile Pompe, what we thought about in the past and what we saw to where we are today. There truly is a new natural history, not just of untreated and when we diagnose, but also in terms of management strategies. The second speaker is going to be Dr. Mark Roberts from Manchester, and he is a neuromuscular physician and is an expert really in many metabolic myopathies. And the third speaker is Dr. Nancy Chen from Taiwan, from National Taiwan University, and she's going to really give us where we've wanted to be and where we are today, that is diagnosis right at the time of birth, and how can we make changes, not only in our consideration of our children with IOPD, but also in those with LOPD. And so truly, I think that this should be the first of many exciting sessions to tell us how much progress has been made. And it was almost endearing when we were asked to stand up by Tiffany from the first meeting to where we are today and the lessons that have been learned. So without much ado, I'm going to give the mic over.